Hello, my name is Daisy and I'll be your nurse practitioner today. Thank you so much for coming in.
Hi.
Hi, can you tell me your name and date of birth?
Audrey Bernard, October 30th, 2003.
Okay, today we're going to be doing a general assessment of your entire body. It's going to involve some touching, some tapping, some pressing, and then I'll also be listening to you with my stethoscope with both the front end and what we call the bell. Do I have your permission to touch?
Yes.
Okay, thank you. I'm going to clean my hands. You'll see me move back and forth as I take notes. That's just me making sure I don't forget anything, okay? So let me clean my hands first. And while I do that, can you tell me what today's date is?
I believe it's March 25th.
26, close enough. And who's the president?
Biden.
Okay. And where are you?
What
city?
Woodbridge.
Okay, thank you. I'm doing a general survey right now of your appearance. I'm not seeing anything concerning. Again, skin is smooth, eyes are reactive, the patient is responding verbally. I see no bulges, no visual issues as we begin. Of course, I'll start with just assessing if the patient has any health concerns. Do you have any health concerns for me today?
Mm-hmm.
On a scale of 1 to 10, with 1 being none and 10 being worst pain ever, could you tell me how you are, or 0 being none, 10 being worst pain ever. Can you tell me what your pain is like right now?
0.
Okay, thank you so much. And so now what we're going to do is I'm going to move on to really just do a quick look at your head first. So as I survey your head, again, your skin looks good, normal, no lesions, no bulges in the heads, no actual concerns. I'm going to palpate your head again, feeling those things that I mentioned before. So let me know again if you have any pain. Palpating for pain, no noticeable bulges or anything there. Okay, also, now as I look at you, you're definitely even symmetrical, no concerns there with the face. And so what I'm going to do from here is progress on to our eyes. So as I look at your eyes, the first thing I'm going to have you do is just take a look. I know that you've told me previously in your background that you've had an eye exam. And that you wear corrective lenses, and you are 20/20 with your corrective lenses. Is that correct?
Yes.
Okay. And so I will mark that within the chart. I'm also now going to take a look at your, what we call our 6 cardinal gazes. So I'm going to have you follow my pen, okay? So just follow it along, keeping your head straight. Okay, and eyes are moving appropriately. Please follow my finger. Now I'm going to just take a look at your peripheral vision. If you could cover one eye and just let me know when you see, that works, when you see my fingers.
I can see them.
Okay, can you cover the other eye? Thank you.
I can still see them. I can see them. I can see them.
Okay, I'm going to do one more time over here.
I can see them. I can see them.
Okay, perfect. Great peripheral vision there, no concerns. Now what I'm going to do is I'm going to use a light on my flashlight, and the reason the light on my cell phone, the reason I'm using the flashlight function is just to look and see if your pupils are equal and reactive. So just look straight ahead at me, and I'm just going to shine this light here in your pupils. Do you mind taking off your glasses for one quick moment? Thank you. Okay, just continue to look straight ahead. And then one more time, just continue to look straight ahead. You can blink as needed. I'm sorry, I'm making your eyes water. Okay, pupils are equal and reactive to light. Now what I'm going to do is move on to your ears. And so in order to move on to your ears, a lot of times there's tools that people use to look into the ear, the otoscope. We don't have that today. We're going to use just the flashlight to look in, and then I'm also going to palpate. So I'm just going to palpate first your ears. No bulges or lesions, any pain as I palpate this area. Mm-hmm. Okay, and then if I had tools, I'd be able to get a clearer look. Right now, we're just going to look with the flashlight. Okay, no concerns, no noticeable lesions, no buildup seen through this visual. Thank you. And now what I'm going to do is just test your hearing for a moment. I'm going to have you pick the ear you cover, and then I'm going to whisper in the other ear, and you tell me what you hear, okay? So pick an ear, perfect.
ABC.
Thank you. Now listen to the other one.
1, 2, 3.
Perfect. Thank you so much. So good hearing on both sides. Now what we're going to do, using again this flashlight, I'm going to look at your nose. First I'm going to palpate, and then I'm going to look up. Can you move your glasses one more time? Thank you. Any pain when I touch the sinus area?
No.
Okay. Okay, go ahead and look up for me. Just a tiny bit of redness in the nose area. Do you have allergies?
Yes.
Okay. But no dripping, just a tiny bit of redness. Thank you so much. Now I'm going to move on to the throat. And when I move into the throat, I'm going to do a couple of things. The first thing, I'm going to step off frame for just a moment and get just a quick glass of water. Because as you're taking a sip with water, I'm going to look at your thyroid. So, and also before I look at your thyroid though, I'm also going to palpate your lymph nodes just to see if any are swollen. So I'm going to touch one more time. Palpating, do not feel any swollen lymph nodes in that area. And so I just want you to take a small mouthful of water, hold it, and we're going to do this twice. And I'm going to palpate from the front, just feeling as you swallow. Okay. And then if you could turn towards the camera, thank you. And I'm going to do it from the back. And if you could swallow again. Good. Thank you so much. No concerns there upon palpation. Now, I'm going to just take a moment and look at your mouth. Normally we look at the gag reflex, but I'm not going to make you gag today. So could you just say ah? Okay, I see that you do have braces. Can you lift your chin up a little bit for me? Ah, say ah. Thank you. Can you put your tongue up onto the roof of your mouth? Thank you. Can you see? Put your head back normal. Can you stick your tongue out for me? Say ah. Thank you. Wiggle it from side to side. Thank you. Any pain or discomfort as you do that?
No.
Okay, thank you very much. Now what we're going to do next is we're going to move on to what we call our respiratory assessment. And just starting off, I'm just going to look at you as you're breathing. So please just disregard me and just breathe normally. Just look normal. Okay, again, I'm now going to do some what we call palpation again down your back, and then later I'll use my stethoscope. I'm really just listening for any abnormalities in your breathing, seeing if there's any wheezing, any concerning sounds. So trying to figure out the best angle for this. If you could turn towards, there we go. And I'm going to move your hair to the side as I palpate down your back. Any pain as I do this?
No.
Okay, can you just take deep breaths in as I palpate? Thank you. And now I want you just to say 99 as I feel. So go ahead, say 99.
99, 99, 99, 99, 99.
Okay, thank you very much. Now I'm going to percuss. That means just tap down your back. You'll hear me kind of just knocking on your fingers like this, and so my fingers like that. So just relax and breathe normally as I percuss. Okay, no concerns there. And now I'm going to listen to your breath sounds. And first I'm just going to listen to them normally, just feeling down your back. And then I'm going to listen to them while you say 99 again. Then you're going to say E, and then you're going to whisper 99 really quietly. So that's going to be 4 ways I listen. And just the first time as I listen down your back, if you could just take normal deep breaths in for me, okay? Every time you feel my stethoscope touch, okay? Okay, very good. Clear lung sounds in all fields. So now what I'm going to do is have you do the exercise when I want you to say 99 every time I touch.
99, 99, 99, 99, 99, 99, 99, 99.
Thank you. Now I want you to say E. Good. Last thing, can you whisper 99? Okay, thank you so much. I'm going to do this similar thing now just on the back. So again, starting, now just on the front, my apologies. I'm going to start with palpating. Perfect, thank you. And so I'm going to touch again, and I'm just again palpating around this area. Any pain or discomfort?
No.
Okay, I'm going to respect your private areas and not palpate there right now. Okay, so now after, because there's no pain, discomfort, I'm going to move down to what we call, again, tapping or percussing. So bear with me as, again, just like I did before, this time just on the chest, okay? Okay, I'll try to respect those boundaries. I know lift. Oh, loosen my stethoscope. Okay. Thank you. And now what I'm going to do is just listen to you breathe, just again on the front. So I want you to, let me take one quick note. Listen as you just take deep breath sounds for me, okay? I'm going to kind of lift. This one. Good. Okay, thank you so much. Again, good breath sounds around, no concerns as I palpate. I'm going to listen just one more time on the front as you say 99, just like you did before, okay?
99, 99, 99, 99, 99, 99, 99, 99.
Okay, just a quick E.
E.
You can take breaths in between.
E. 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 E.
Okay, thank you. Now what we're going to do is we're going to move on to our cardiac assessment. And our cardiac assessment, I'm looking at your blood flow, and I'm just seeing if there's any issues or concerns. And I also want to see just generally how it's your heart sounds, no murmurs or any abnormalities. Can I start with your hands? Your hands are pink, good capillary refill. Okay, I'm going to take your pulse. You could lay down for me. I'm just going to look at your jugular for a second and just feel first for this jugular pulse. Bilateral, it's looking good and strong. If you can tilt your head to this side. I'm just watching the blood flowing. Okay, and kind of just measuring that flow right there. Really what I want to do now is I'm just going to feel a little bit while you're laying down around your chest, and then I'm going to listen. I know I'm going to respect your body as that, and so I won't feel too much. Okay. I'm going to take time now just to listen to your blood flow as I'm listening to you here. first with the front of my stethoscope, and then as I move around, I'm also going to use the bell, okay? And actually, you can sit up for this part. I will have you lay back down when we go to our abdominal assessment. Okay, moving to the bell. Okay, thank you so much there. Sounding good. Real clear sounds. Now, as I mentioned, we're going to look at your abdominal. That helps me see your GI or gastrointestinal system. I'm not going to look at your gastrourinary, which means kind of the genital urinary, I apologize, which means kind of your vaginal area and stuff. We're not going to look at that. We're going to leave that alone today. But if you could lay down as I do a quick look at your abdominal area. So this is going to involve a couple of steps here. I'm going to listen to the sounds. I'm going to percuss your liver and spleen, which means just tapping. And I'm also going to press down lightly and then hard, just because that allows me just again to feel what's going on here. If there's any pain, please let me know. So I'm going to be starting by listening to your bowel sounds. Good active bowel sounds, no concerns for me there. Now again, I said before I'm going to press, and so please let me know if there's discomfort. I'm going to first press lightly. Okay, I know it tickles a little. No pain, only tickling. You can respond.
Yes,
okay. And then I'm going to press a little deeper, okay? Just still tickles.
Sorry, this feels weird.
Okay, no pain as I press deeper though. Okay, thank you. And now I'm going to do the tapping, and this will help me percuss our liver and our spleen. Again, it's going to sound not so hollow as it does over your stomach, so just bear with me as I first start tapping. And over here. Okay, we're feeling well. Any pain as I touch that? Okay, thank you so much. If you could sit all the way up for me again, maybe turning just a little bit to the camera as I just do a quick assessment of the kidney area, moving your hair out of the way. Any pain as I'm touching here?
Nope.
Okay, I'm going to do a hard tap. Any pain or discomfort as I do that?
Nope.
Okay, perfect. Your GI system and abdominal exam is looking very good. We're going to now look at what we call your musculoskeletal. So if you could turn to me, if you could shove your sleeves up just a little bit. I just first start by just doing a general assessment of the arms, legs. I can't see underneath the jeans, but that's okay. The patient has not told me of any concerns, so I'm not going to address any of that. Again, skin appears healthy and normal. And again, I already looked at the hands and the capillary refills. I'm going to look at the feet. If I could ask, do you mind taking off your socks for me? Thank you. And what I'm going to do is just look at her feet and then also feel kind of those pedal pulses, just making sure there's also good blood flow there down at the feet. So I'm going to kneel down here and just look at those pedal pulses. Okay. Again, that looks good. No concerns within the pedal pulse. So what we're going to do now is just, again, as I felt down the arms and legs, no concern, no bulging. You did not tell me of any pain. And so now I'm just going to test your strength. So if we could start, first just kind of push up with your arms. The arms push up. Okay, push down. Can you hold your arms like this? Okay, push, pull. Okay, good strength on both sides of that. If you could squeeze my hands. Thank you. Good strength on both hands. Writing that down. And then what I want you to do is, if you could lift and lower your legs with resistance. So push up on my hands. Okay, pull down. Good job. Push against my hands. Other direction. Or do the same with your feet. Push against my feet. Okay, lift up, push it. There we go. Again. And again. Thank you very much. Good strength all around. Finally, just legs straight. Push up against my hand. Good. Down. Thank you. Good strength, able to on all sides with resistance. So our last part of our exam today is what we call our cranial nerve assessment. And the good thing is we've already looked at several of your cranial nerves throughout this process. So as we go through, I'll just remind you of the ones we've already looked at, and then we'll assess the things that we haven't done. For example, we've already looked at, we haven't looked at your sense of smell. So that cranial nerve 1, I want you to close your eyes and plug one nostril. Tell me what you smell.
Strawberry.
Okay, can you close the other nostril? Do you smell the same thing?
Yep.
Okay, perfect. So that's great. So 1 down, just 11 more to go. We already talked about your optic exam. When we explained that you wore glasses in 2020. You followed my finger, so no concerns there. So that was looking good. Now what we're going to do, we touched a little bit with 3 through 7. We're going to do a couple more exams just to make sure. Could you smile for me? Thank you. Could you blow out your cheeks? Okay, could you give me a grimacing frown? Their eyebrows up and down. Okay, looking good. Extra movements there, looking good. I want you now just to tell me, this is going to be kind of what we call our soft, and this is going to be our sharp. Okay, can you see the difference there? I just want to tell me first when you feel.
I feel it. I feel it. I feel it.
Can you pull up your sleeves one more time for me? Thank you.
Feel it. I feel it.
Okay, now I want you to tell me if it's sharp or soft, and for this I need you to close your eyes.
Sharp. Soft. Sharp. Soft. Soft. Sharp. Soft. 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 Sharp. Sharp. Soft. Soft. Sharp.
Just going to do the same thing on your feet.
All right, sharp.
Good.
Sharp.
Okay. Now I want you again to tell me, we already did our whisper test, you know, when I whispered each ear, so check off on nerve 8 there. But now we're going to look just kind of at your gait a little bit. I don't want you tripping. I saw you walk in, you've done some strength building, but first I just want you to go ahead and stand up for me and walk to the wall normally and then walk back to me. Perfect. Now could you walk to the wall, heel to toe, heel to toe? Steady gait. And then could you come back to me walking on your toes? Thank you. Okay, straight right there. Now, if you could close your eyes and just stand still with your arms to the side. And I just want to observe this for a little bit, just looking at your balance. Okay. Now, could you put your arms straight out in front of you? And just hold it just like that. Again, looking at balance within this situation, looking good. No concerns there. Thank you. You can open your eyes. You can go ahead and have a seat again for me. And if you close your eyes, I'm going to put something in your hand. Could you tell me what it is?
Chapstick.
Okay, perfect. Keep your eyes closed. I'm going to put one more thing in your hand. Could you tell me what it is?
An earring?
Yes, good job. Opening eyes, so those nerves were looking really good, 9 through 10. If now, as we go, I want to look just really quickly at your reflexes. And so I'm going to be using my stethoscope just to tap because I don't have a hammer. Just relax. Okay. Just relax your arm right there. Relaxing. Okay, elbow out. Maybe let's pull this sleeve down for me, please, on both sides. Thank you. Relaxing. Okay, little taps. Okay, and now I'm going to look at your knee. down here. Okay, looking good there around all the reflexes. Already for 11, palpate it down your spine for our nerve 11. But now I just want you to push up with your shoulders. Okay, good to go. No, good resistance as you push up there with your shoulders. Now I'm going to look at your face, and I want you to push against my hand. No, not your body, just your head. I'm sorry, that was clear. So turn your head towards my hand. No, like this.
Oh, okay.
Good. Now other side. Good movement. Thank you very much. Sorry for the confusing directions. Now our very last for our vasovagal, for our very last nerve test, I want you to go stick out your tongue. You've done this a little bit already. Say Perfect. No concerns. So in our general assessment, I did not see any concerns. I saw a tiny bit of pink in the nose, which you told me is normal for you with having allergies. Normal bowel sounds, normal pulses throughout, positive, good strength throughout your body, and no concerns with your nervous system as well. No GI concerns. Overall, looking quite great. Thank you so much for joining me today.
Thank you.